welcome to our LSS Partners meeting. Michael Best has been a partner of LSS for many years. My name is Jose Olivieri. I'm the chair of the LSS board, and I'm a senior partner at Michael Best. So I want to welcome you all and thank you all for being here. We've had great turnout and we've got great guests. So I'll turn it over to the program.
Perfect. Thank you so much, Jose. And I'll let you know, we're going to start with the mics and see how it goes. But I understand that there are mics in the ceiling, which will also pick up some discussions in the audience as well. So just wanted to let you all know that as a part of housekeeping.
We're watching you everywhere.
Well, first of all, I just want to thank you all for being here and for your support of Lutheran Social Services of Wisconsin and Upper Michigan. As I walked in this morning and came into the lobby, I was talking about the reason that I was here. I was here for LSS, and we were doing a panel on youth mental health. And one of the people in the lobby said, what I wouldn't do to be in that discussion. So it let me know that this is a really important topic that is on a lot of minds. And I'm honored to be facilitating today's discussion. My name is Mara Ditchkens, and I am the Chief Advancement Officer for Lutheran Social Services. And today's panel brings together 3 individuals who are dedicated to the betterment of our community. So I'd like to begin with just some brief introductions. Mayor Cavalier Johnson took office as acting mayor of the city of Milwaukee in 2021. Before stepping into that role, he was Common Council President while representing the city's 2nd Aldermanic District. Then, in April of 2022, Mayor Johnson was officially elected, winning more than 70% of the vote. While he is Milwaukee's 45th chief executive, he is the first Black mayor elected in the city. While his attention is focused on many issues and initiatives, he has prioritized violence reduction, economic development, and health and safety since becoming mayor. Mayor Johnson grew up in Milwaukee, attended Milwaukee Public Schools, and is a graduate of UW-Madison. Amy Lindner is president and CEO of United Way of Greater Milwaukee and Waukesha County and is committed to fighting for the health, education, and financial stability of every person in our local community. Under Amy's leadership, United Way has raised more than $300 million for the community. Before taking the helm at United Way, Amy served as president and CEO of Meta House, a Milwaukee-based nonprofit that seeks to end the generational cycle of addiction by healing women and strengthening families. Prior to her work in the nonprofit sector, Amy was a partner at the law firm of Reinhardt, Verner Van Duren.
It's a curse, that's a curse. You allow curse words.
Surprised you allowed her in.
Oh gosh. And lastly, Héctor Colón is president and CEO of Lutheran Social Services of Wisconsin and Upper Michigan, a nonprofit organization that serves nearly 30,000 people across its 2-state reach. Under Héctor's leadership, LSS has adapted new models and business strategies to drive innovation and increase operational efficiency and excellence. But I think one of the things that Héctor would tell you he's most proud of is the positive feedback of LSS clients. Over 95% of the people served say that LSS improves their quality of life, and LSS has a 97% client satisfaction rating. Before stepping into his current role, Héctor served as executive director of the Milwaukee County Department of Health and Human Services, where he led several county-wide initiatives, including efforts to reform the juvenile justice system, end chronic homelessness, transform mental health care, and end a 30-year wait list for disability services. So I think it's safe to say that whether it's through direct service, advocacy, thought leadership, these 3 have touched countless lives in our community, and I'm so honored to have them here today. I'll start by just setting an intention for this morning, and that really is to uplift our community's children, to talk openly about youth mental health, and discuss 2 school-based initiatives that are making a huge difference in our area. Amy will be telling us about Mental Health Schools of Distinction, a United Way initiative, and Héctor will be sharing information about school-centered mental health, a program of LSS. And finally, we hope to walk away with some ideas on how each of us can support the children, parents, and caregivers in our own lives, as well as take care of our own mental health. So I'll begin with some statistics. The CDC reports that 1 in 6 children aged 2 to 8 years old has a mental, behavioral, or developmental disorder. For adolescents, depression, substance use, and suicide are important concerns. Among adolescents aged 12 to 17 years old, reporting to the CDC, almost 40% had persistent feelings of sadness and hopelessness. And many reports reflect that these numbers are only increasing as a result of the pandemic. According to a poll conducted by NAMI, the National Alliance on Mental Illness, teens want schools to play a big role in their mental health, and they trust the information they get there. 2 in 3 teens agree that schools should teach about what mental health is, including where and how to seek treatment. 4 in 5 teens who seek mental health information from teachers say that they trust their teachers and the adults in the school to help them. And even so, according to the same NAMI survey, youth believe that their schools could be doing more. NAMI also reports that half of all mental health conditions begin by age 14. ADHD, behavior problems, anxiety, and depression are the most commonly diagnosed mental health disorders in children. And yet only about half of the children with mental health conditions receive any kind of treatment in the past year. So there are a lot of children who are going unserved. NAMI also reports that, let me see here. Finally, in 2023, the Pew Charitable Trust compiled data on youth suicide, which increased in 2021. And this led them to say, what's going on? Let's start bringing all of this data together. And what they found is that female students are at higher risk for suicidal thoughts than their male counterparts. 30% of females surveyed said they seriously considered attempting suicide. Black students were more likely to attempt suicide than their Asian, Hispanic, or white peers. And a higher percentage of American Indian and Alaska Native students experienced suicidality in 2021 than all other races and ethnicities. Lastly, we know that LGBTQ plus teens in 2021 were 3 times more likely to consider suicide than their heterosexual peers. So that brings us to our panel discussion. And the first thing I'd like to ask is, I just shared some information about our youth. What is one key factor that you see impacting youth mental health today? And Mayor Johnson, I'll start with you.
Thank you, Mara. So, well, good morning, everybody. First, let me just say that it's really good to be here. It's one of my favorite developments, favorite buildings, and the views here are incredible. One thing that I did not know is that they had microphones in the ceiling. Make sure there's some of those in City Hall. But in all seriousness, so thank you for, again, allowing me to be a part of this esteemed panel with Amy and with Héctor to talk about this issue that I believe is really, really important. And, you know, when you look at the information that Mara just discussed, it takes me back to this initiative that I led on when I was on the city council, right? And it was because of some of these same instances, some of these same statistics that Mara's talking about, especially the isolation, the homelessness that could result from this, the suicidality, the push sometimes to go into alcoholism or get involved with other drugs, especially for LGBTQ plus youth in Milwaukee. When I was on the city council, we led an initiative to ban gay conversion therapy in the city of Milwaukee, because all of those things that you just discussed were impacting communities that or LGBT plus youth in the city. And so we stood up, we said we're gonna be an ally, and we worked to get that new policy implemented. And we had really a statewide effect because there's no statewide prohibition on that practice. I said I didn't want for that to get a stronghold in Milwaukee. And so even though it was controversial and every single council member was being pushed in a direction that was uncomfortable for them, we still stood strong. We got it passed And then you started to see after Milwaukee walked through the door, other communities around the state did the same thing. They were hardened, they felt strengthened, they felt like there was a leader who stood up and led the way. And so from Superior to Appleton to Racine to Madison and so many other places across the state, other communities stepped through and led the way on that. So one of the things that I see is the need for people to stand up and be real allies, whether they're LGBTQ plus youth or whether they're other youth who may be negatively impacted by some of the crises around mental health affecting young people, and not just in Milwaukee, but in communities all across the state, and not just in Wisconsin, but also in Michigan too, since LSS serves not just Wisconsin, but also the UP as well.
Thank you. So we're isolation and being allies. Hector?
Yeah, when I think about these sobering statistics, 1 in 6 children having a mental health issue, 40% of, I think it was high schoolers, sadness and hopeless, and just the suicide numbers. It's really sad to see that this is our current state. And when I think about this, I think about trauma as a big contributing factor. In some cases, intergenerational trauma, but kids that have been emotionally abused, sexually abused, physically abused, it has a very negative impact on these kids and their health and well-being as they grow up, which I think are contributing factors to this. That's why many in our sector have a strong focus on trauma and early intervention to address those issues that children are going through early on in life and give them a chance and empower them and give them a chance to succeed in life.
I'll add just 2 quick things that I think even kids who are privileged to not be in households that are economically disadvantaged or where trauma is happening that impact all kids, best I can tell, that's different than when most of us are kids. One is the ubiquity of social media, news coverage, how fast information travels. Something bad can happen in the world anywhere, and you have access to it everywhere. So the onslaught of negative news is nearly ceaseless for all of us, including the young people in our lives. That's different than when we were young. The second one I will mention is that parenting has really changed. And this is kind of an uncomfortable topic, but I'm a Gen Xer. I was a latchkey kid. I was a fend for myself kid. If I forgot my key at home and got home and I couldn't get in because I didn't have my key, I had to problem solve around my climbing in the bathroom window and my going to the next door neighbor's house. I didn't have a cell phone. I can't call my mom. You had to problem solve. Parenting today is very different. Parents have been very, very engaged in problem solving with their kids, which is amazing. And has, in some regards, hurt children's ability to have confidence in their own problem solving ability and their own resilience. When we don't trust our kids to find their own way within the safe confines of us as parents, we are holding our children back from really important developmental work, and we're seeing some of the anxiety that kids are experiencing, depression kids are experiencing, but they don't have those skills, but are expected to be operating in the adult world.
Thank you. Mayor Johnson, what are some of the costs of unaddressed youth mental health in the city of Milwaukee?
Thank you. Some of the costs for unaddressed mental health issues for kids, for us, I always like to say, I'm mayor of all the people, especially of the kids in Milwaukee. And I've got 3 myself. We got a 13-year-old son and 5-year-old twin daughters. So this is something that I take very, very seriously. But what are some of the challenges, some of the costs that we have? Look, when a young person faces suicidality and hurts themselves or commits suicide, there's a cost to that, not just for themselves, but for their family and for other kids, their friends in their school. If a young person is couch surfing, doesn't have a place to stay because they're homeless, right? And they take those experiences with them to school, there's a cost for that, right? If a young person is out on the street and they get involved with the wrong crowd and they start potentially hurting somebody or hurting themselves, there's a cost to that. Really what we should be doing is working to make sure that young people especially are on a path or in a position where they become productive contributing members to our society. that's the sort of city that we should be building. Those are the sort of values that young people should be getting in Milwaukee and other communities around the state. And that's what I want to see. But if there are these mental health concerns for kids, that takes away from their ability to do that. And so there's a lot of work for us to do to make sure that that doesn't happen for more kids in the city.
That's great. And I know that we only have a limited time with you this morning, Mayor Johnson, so can I ask you just a quick follow-up? So both LSS and United Way are providing youth mental health programs embedded in area schools to make sure that young people are served in the spaces where they spend a lot of their time. Why should school-based mental health programs matter to the business community and leaders in Southeastern Wisconsin?
That's a great question. It's because, look, the youth are our future. They really, really are. I mean, I know that's a fancy slogan from back in the day, and, you know, to get people warm and fuzzy about kids, but really, it's the truth. And when you look at, you know, who your employees of tomorrow are going to be, you look at those classrooms, right? When I look at, you know, the folks who are going to fill positions in city development and in public works and in neighborhood services and so many other functions in my administration in the city, I need to look into those classrooms. That's why I spend so much time during the school year in classrooms all across the city of Milwaukee, right? And so if we want to build a strong society, if we want to make sure that kids, again, are in a position where they're going to be productive, contributing members of society, then we need to make sure we're taking care of the whole kid. I often joke with my older brother, because I've got two older brothers. One has unfortunately been in prison as long as he's been able to go, and not a prison, he's in prison now. And I've got another brother who's a warden in a Wisconsin prison. And at a time, it's been kind of awkward, but my brother who's been in prison has been the inmate of my brother who's a warden. Think about how that goes. So I tell my brother who's a warden, like, look, I love you, bro, and I want you to have a good job and take care of yourself and take care of your family. But what I would like to see is for us to be in a position as a society where we're putting you out of work because we've made these investments, including these sort of investments, on the front end of a young person's life so that they don't end up in a situation whether they're homeless or committing suicide or in the correctional system as well. So there's a lot of work for us to do, and that's why folks in this room should be concerned about it too. Because if somebody goes into a prison, that's a cost that all of us are paying. It's a cost that everybody pays. I mean, think about this, in the state of Wisconsin, we spend more money on prisons than we do on the University of Wisconsin system, right? And folks are paying for that. Folks are paying for that one way or another. Either you're a victim of some crime that somebody who's incarcerated has committed, or your tax dollars are going to support those prisons, right? So there is a cost to that for all of us. I would much rather that those young people grow up and are in a position where they're contributing to businesses, contributing to neighborhoods, contributing to vibrancy and positive life in neighborhoods all over Milwaukee and across the state than the alternative in going into the correctional system.
Héctor, would you like to add to that?
Yeah, I like this, your comments about taking care of the whole kid. And for us, that also involves the parents. And we view the parents as an opportunity for employers in this community to hire, to train, to help them develop the skills, to meet your workforce needs. And also, as the mayor said, these kids are your future. They're our future. They're the future of the city. They're the future of this economy. They're the future workforce. So it's in our best interest to make sure that we're doing everything we can to give these kids an opportunity to succeed in life, to be your neighbor, to be your employee, and to be your friend. And the other, I just want to, the fact that we spend more money on prison than the UW system. I'm a UW Board of Regent, and I could tell you the huge return on investment that we have at this wonderful UW system institution. And it's just sad that the way we have this is backwards. We should have more resources on prevention, early intervention, and education, so we give everybody in our community a chance to succeed in life.
I'll mention just one last thing. You as business people today running your businesses, when you hear numbers like 44% of kids reporting, all-time high, reporting persistent feelings of sadness, anxiety, or depression, those kids' parents are working for you today. If you think no parent is happier than their least happy kid, no parent can focus more than they're worried about their kid that's most in trouble. And so this is a right now, today problem for people working for you today. And so when we help people today, you are further helping your businesses in addition to, as the mayor mentioned, the future concerns.
Thank you. Now, Mayor Johnson, can you tell us about Milwaukee Peace Week, which takes place in May? What outcomes have you seen as a result of this week-long observance?
Sure. So I'm very proud of Peace Week. Some of you may recall that the former mayor had what he called a ceasefire Sabbath. And so we put our own twist on it. I worked in the mayor's office years ago, actually almost 10 years ago, wow, as a staffer. And when I came into the office, I worked to change that program around. So instead of doing a weekend of activity, we changed it to Ceasefire Week, and it became a week of activity. That didn't last after I left the office, but I thought it was important to continue that on. And so when I was elected mayor, I decided to bring it back, put this whole other twist on it, and make another week where we focused in on issues of violence and bringing neighbors together, bringing clergy together, and focusing in on issues of public safety in Milwaukee. And so what I've seen from our inaugural Peace Week is neighborhoods that have really come together. Neighborhood organizations that have stepped up and said, I want to be a part of the solution. I remember we had a peace walk with our partners over at Journey House. And when I'll never forget when I was there on their playground, and I'm looking out, there's the organizers, folks from Journey House, and kids that were there with us. And then by the time we started walking around the Clark Square neighborhood, I had seen some folks on the porch like, what's going on? And so I stepped up the porch and say, hey, I'm the mayor, and we're doing this walk for peace to just bring awareness to this. And I was able to turn back and look at the crowd, and it had grown like blocks deep, because folks in that neighborhood were really interested in this concept of making sure that they put one foot in front of the other to promote peace in their neighborhoods and throughout their city. And the members of clergy in our community from all sides of town stepped up and opened their doors to promote peace as well. And we used the opportunity to do what I continue to do, and that's call on parents, call on teachers, preachers, mentors, friends, to do all that they can to reach out to people in their lives who they know may participate in some illicit activities, some illegal gun use, and hurt people or possibly hurt themselves, and get them to get those folks to make a different consideration in life. And look, we have challenges in Milwaukee, right? It's a city, and we don't control every aspect of gun law. I mean, that's a state level and a federal level responsibility. But it's things like that and bringing neighbors together in that sort of way that helps us to make some improvement. I mean, today in Milwaukee, we continue to see positive trends as it relates to violence in the city. Last year, we were able to get violent crime down some 15% from the year prior. And this year, those trends continue. I mean, even homicides are down some 20% in the city of Milwaukee when you look at last year, which was also down from the year prior. So all these things, they add up together. It's not a silver bullet. It's not one mayor, one police chief, one department, one organization, whether it's United Way or LSS, that can unilaterally solve these problems. It's all of us working together in partnership, and that's what Peace Week is all about. It's about lifting up partnership.
I love that, and I love that Milwaukee Peace Week also emphasizes the root causes of trauma. There's some addressing of mental health, and you talked about bringing people together in collaboration, and I know that you had also talked about that need for allies. So in raising awareness in these issues, how do you think that businesses and nonprofits can participate in that awareness building? And what is the importance of all of us being those allies?
So my wife and I just this morning or yesterday, it's funny that Amy talked about being a latchkey kid and just how things have changed. There's a cartoon or an image of a cartoon in a newspaper that just I saw many years ago that just continues to stick out with me. It was back in the day. I say back in the day, right? So even when I was a kid, it used to be that if you were a kid and you were misbehaving in school and all this and all that, your parent would come to school and the teacher and the parent would be lecturing you and saying, hey, you need to turn around and improve your actions here. Today, unfortunately, it seems like it's the other way around. It's like the kid and the parents yelling at the teacher. It's the other way around. And so, for me, when I talk about partnership, I want for us to make sure that we're holding folks accountable. And I want to work to make sure that folks in Milwaukee, whether they're a young person, whether they're a student, whether they're a teacher, know that there's a path forward, but you have to be accountable for the things that you do in our city. And I think that things like Peace Week helps to do that. And I think, as far as what nonprofit organizations, what businesses can do to help us to do that, is to support some of the programs that are presently out there, like our long-standing Earn and Learn Summer Youth Jobs Program. That's a program that is helping young people in Milwaukee, and has been for the last several years, probably 20 years or so, to have a foundation on which they can build off of. And it's not just Earn and Learn. I mean, we just created a program 2 years ago called Camp Rise, and it comes out of my lived experience from participating in programs of the YMCA when I was a kid. And so we take young people in Milwaukee, and we need partners in order to do this. We take young people in Milwaukee, we pair them with caring adult mentors or partners in this work. We work with kids as young as 10, kids who otherwise may be encouraged by some of their peers to steal cars and things like that. We get those kids out of their neighborhoods. We give them exposure to other things. We give them a job to do. We put money in their pockets so they know the value of work and an honest day's wage or an honest day's work. We do all these things, and we put kids in a better position. And when you look back at what parents have said who've been surveyed about participation here, 91% of parents have said that, hey, we've seen growth in our young person because they participated in this program. So we started off last year with 200 young men, primarily 200 young men of color. The big complaint that we got was that girls were not involved. And so this year we expanded that to include 50 girls as well. And the only way that we can do this is we have to raise the funds to keep this program going is by having partners in the nonprofit sector, partners in government certainly, partners in private business as well, so we can keep programs like that going. So there's so much work for all of us to do. There's so much partnership that all of us can embark on in order to make our neighborhoods stronger and safer and better for all of our kids and all of our families in this city.
Wonderful. Well, I know that you have to leave us, so if we can all just give a hand to Mayor. Thank you. And we'll spend the second half of this discussion really diving in deeply to what it is that we're doing for you in our community. So the first question I will pose to you, Amy, and could you provide a brief overview of mental health schools of distinction spearheaded by United Way of Greater Milwaukee and Waukesha County?
You bet. So we at United Way think about not only what are the day-to-day problems happening today, but also how do we start to change the trajectory of longstanding issues in our community. And our newest initiative is called Empowering Minds. There are some of these outside. There's a foot page in there on this. You can read about it. And the idea of Empowering Minds is more than mental health and all the way to mental wellness. The Department of Public Instruction in the state of Wisconsin has already identified youth mental health, school-based youth mental health as a proven practice. Other communities, we know this works. When communities get this right, the kids in those communities are healthier, families are healthier. So the idea is knowing where the kids are and helping schools implement what DPI has already told schools they should be doing to be able to comprehensively care for the mental health of those kids. So DPI has found the best practices, has told schools they should be doing it, but has not yet resourced it in a way to make it actually feasible for most schools to do this. There is no school in the state of Wisconsin who's saying we do not want to be caring for the mental health of our kids. Every school wants to do this. They need the support to be able to do it. So there are 6 criteria that DPI has identified that a school needs to have in place to be able to comprehensively do this work. They have to have a needs assessment. They have to build a plan for collaboration. They have to have referral pathways. They have to have access to comprehensive resources, have plan for sustainability and the evaluation to make sure the way they're doing it is right. And will work. So what we at United Way are doing, we're in our pilot year, we're working with 2 schools currently, JMAC here in MPS, as well as Waukesha South High School in Waukesha, to say, what is it that each individual school needs? What assets are already in place? And how can we help fundraise to provide technical assistance for that school to implement these criteria? This pilot year will tell us a lot about how much this costs. We've got some hypotheses, but we want to see how fast a school environment committed to do this can get this work done. And both of those will help inform a goal we will set and hope to announce to the community in the first half of next year about how fast can we scale this. This is not a district level effort. This is a school by school effort because every school has different needs. Every school has different existing infrastructure and benefits, like the schools that are already working with LSS. And so it has to be an individualized plan for that school. But this is eminently doable. We know it works. And when we get this right, those schools are healthier, those kids are healthier, teacher retention is better. 100 good things happen from getting this right.
And Héctor, can you provide an overview of LSS, school-centered mental health, the model that's being implemented, where you're working, and what really is the special sauce of this program?
Yeah, thank you so much. So school-centered mental health. So before I got to LSS, there was a federal grant that LSS had with Dodge County. And they had it it was a 5-year grant. And before I got there, the grant ended, and hence the program ended. But I learned about it, and it had incredible outcomes. And it had the right approach in working with kids and families early on, providing them with the mental health services they need, but not just them, but also the parents. So that evolved into a discussion with my team and said, we should bring this program back and fundraise to try to make it happen. And we started a pilot with UCC, with 1 school. We started receiving great feedback and outcomes, and we expanded that to 3 schools. Then MPS found out about our program, wanted us to expand in their schools. We're in 11 schools. Then Marquette University approached us to be a part of the Success Center, which really treats individuals that have been really falling through the cracks within MPS and have trauma and those mental health needs. And so the program that we have is really comprehensive. So there is a therapist that provides the child with therapy services to address their mental health needs. But then the secret sauce is that family coach that we have within our model. And that family coach really works with the parent, with the school, with the teacher, with the child, but a strong focus on that household. With the understanding and looking at the broader social determinants of health, with the understanding, the better that household is, mom, dad, brother, cousin, who's ever there, the better that child is going to be. Are they in a safe neighborhood? Is their house affordable? Do they have transportation? Do they have medical assistance or a doctor? Food insecurity. We look at all of those social determinants of health factors, and the better we address that, the better it's going to be for that household. So this is about early intervention. It's about prevention. It's about getting to these kids and families early, not just the kid, but also their parents in that household.
That is terrific. And you had mentioned that MPS approached because of the outcomes that you were seeing. Can you talk a little bit about the outcomes across the 11 schools where LSS is currently working?
Yes, thank you. So over 70% of the parents report that their children have improved in their pro-social skills. Attendance is better, grades are better, the child engagement in the classroom is better, their mental health symptoms are better regulated. So from all those factors play a big role in why these schools really value our services and actually want more of it.
Okay. And then I have a question for both of you. Is there more demand for these programs than you're able to accommodate? And I know, Amy, yours is a pilot, but are there already schools lining up at the door and people who really want to be a part of this initiative?
Yeah, absolutely, yes, right? So then you think like, okay, like we can't snap our fingers and have everything the way we want it to be instantaneously. So what can we as parents, what can we as grown-ups, adults, people who care about the kids in our lives do to be helping these kids? And there's so many things. We often use the word mental health, which is, a little bit of a medicalization of something that is endemic to all of us. A broader term is mental wellness. I'm looking right at Susan Lubar, because there are things that all of us can and should be doing to care for our own mental wellness, what we're modeling for our kids, and then to help our kids' mental wellness. So I think about things like modeling behaviors like talking about your own feelings, modeling behaviors like not avoiding a difficult topic with your kids because it's hard to talk about, accepting the fact there is never going to be a perfect time, there never is going to be a perfect script, and it can't just be one conversation. That when you, the less likely you feel like talking to your kid about the thing, it might be like the sign that like I really got to talk to my kid about the thing, even if I don't know what to say. Things like protecting your own sleep, eating well, a spiritual practice if that's meaningful for you, a healthy diet. Like we don't often think of those things as mental wellness, but they are. It's part of how we keep all of ourselves well. I also think about things like trusting our kids, right? There are times when we, especially the older your kids go, right? This is a spectrum, right? You can't trust a 2-year-old, they don't trust 2-year-old. But as your kids get older, when we're talking about situations where their own safety is not in question, when they are physically safe, when they are mentally safe, the more autonomy we can give our kids to shift our roles from telling our kids what to do to equipping our kids with information about our values and helping our kids decide how they want to proceed and supporting them in those efforts. We are building confidence. We are building a self-belief. We are building the skills that then get implemented in every other part of their life. And I know it's hard to do, right? Because you have an idea, you love these people beyond measure, you want what's best for them, but remembering that part of what's best for them is them learning that they get to self-direct eventually, and that you are there not to tell them what to do, but to help them thrive.
Great. And Hector, what about you? Is there more demand for the school-centered mental health program than you're able to accommodate currently?
Absolutely. Today, UCC is asking us for another therapist. MPS wants us to expand in other schools. I meet with lots of people in the community, really across the state, and they learn about this program. They say, hey, we'd love to have that here. So clearly, like was said earlier, 9 in 10 schools across the nation want more mental health services. So definitely the need is great, but there are challenges to scale.
If I could just build on there, like one of the first things that if you're talking to anybody who knows the space at all, one of the first things you hear is there are not enough therapists. The waiting list is off the charts. Like I could add therapists if I could find them, but I can't hire any. That is one of the reasons that school-based mental health and mental wellness efforts are so important. The average wait right now between the first symptom of a child experiencing a mental health issue and treatment is 11 years. Think about that in the physical health space. Do you want to treat cancer when it's at stage 4 or when it's at stage 1? Do you want to help somebody with their diet when their blood sugar is raising or after they've been diagnosed with diabetes? Of course we want to get there earlier, because some kids are always going to need inpatient care. Some kids are always going to need the highest level of psychiatric care. Lots and lots and lots of kids would not need that level of care if we were intervening earlier, if we were practicing better mental wellness earlier. We could keep kids off the need of having to get to the very precious resource of a child psychiatrist or a child therapist if we were doing this better. There are right now 300 schools in the state of Wisconsin that have peer-led groups with proven results. Again, some kids need therapy, lots of kids don't, but we've got to put in the work on the front end of helping them earlier and better.
And I think then what I'm hearing too is that you had talked about empowering minds. So really through these school-based programs, the idea is that you are strengthening institutions, communities, you're destigmatizing mental health, you're really allowing people to have an open conversation about their own mental health and take the reins of that and empower some of those adults who, as we heard from the NAMI survey, are so trusted by the youth in their care. So what do we do for kids who are waiting for services, Amy?
Yeah, we talked about some of that. So again, services, we think of therapy, which is important, but it's not the only one we want to need. So, I think a lot about parents I admire so much. Full disclosure, I'm not a parent, but I love lots of parents who love their kids. I love their kids. When I think about parents that I admire, part of what I admire is the courage of the ways they engage, right? So at some point, your kid is going to do something boneheaded that you deeply disagree with, maybe once a day, like it's just going to happen. So, when that happens, you have such a choice to make about what happens next. So I love this mom I know who found her child reading a book that had some themes that mom was not excited that child is engaging in right now, right? So what do? Do you try to ban the book? Do you try to punish the kid? What do you do? You can't unread a book. She has read the stuff that she has read. Where do you want her to take those questions? Do you want to take them to you, or do you want to take them to the internet or her friends? Correct answer, you, right? So, to talk to her about those kinds of things. I know a child who's smoking pot at home, and mom and dad are really unhappy about that for, obvious reasons. So you can punish him, you can ground him, you can take away the car, you can do the things, and, they did some of that. But you also want to figure out, why is my 17-year-old smoking pot at home? What's going on for him? Engaging with him, finding out he's got an anxiety disorder eventually, right? But in all of the weeks while they're waiting for the appointment with that precious therapist, they're having conversations about what's going on for you. They're having conversations of love and curiosity and engagement and interest, and not just conversations about punishment and blame and anger, which are human, obvious emotions. There is nobody more powerful in the lives of your kids than you. And you, of course, are trying to impart your values to your kids, but your values should never be the trump card. The love for your kid should be the trump card. So your kid should know your values, should understand why that influences what you're asking from them. But the love of your kid is so, so, so much more important than the one thing that happened. And I think busy, parents just can lose sight of that. Parents with their own struggles can lose sight of that. And so the last thing I'll add is I talk about these kids with personal knowledge because I am also a loved one in their life. So I am not a parent, but I love these kids, and being not the parent, I think, has advantages and disadvantages in talking to their kids. I want to be careful to not overstep my bounds. Their parents' values are more important than my values, and I should be aware of that and deferential to some extent to that. But also, they're going to tell me things they're not going to tell their parents. And so for the other people in your lives, reminding their kids, particularly their adolescents, that you love them, that they can always call you, that they can always talk to you, I think is another really powerful way we can show up for kids who aren't our own kids.
And Hector, a follow-up question for you. What will it take to expand school-centered mental health across the state and beyond?
Yeah, thank you. So first, I think philanthropy is really important and very key for us right now to really have this program. And more so if we could have more to be able to scale it. But that's the important part of that is how can we articulate and prove that this is working? And that's gonna take some time, but right now we're seeing the results. And we're starting to share those results, which in turn might make it very advantageous to amend the Medicaid plan so that we can have this family coach reimbursable under the Medicaid package. That's gonna bring in a significant revenue source that will make this more scalable. And the last thing is legislation. And so we currently have some individuals from the legislature that have agreed to write legislation to include LSS in some pilots. And there is evaluation within there, and we hope that it'll pass. And so we're gonna be reaching out to all of you to maybe send us letters of support so that we can be successful in that effort. But the whole idea here is to have this pilot, to show the outcomes so that people can see this works. And philanthropy is gonna wanna support it. Medicaid reimbursement will increase and become available to expand this program. So I think all of those things are important. And I just wanna say, Amy, love you so much. We go way back from the county days. She's a fierce negotiator, very passionate about what she does, and her heart is totally in the right place. So as you think of scaling Empowering Minds, again, through philanthropy, hopefully Medicaid reimbursement, all of these things, please think of us. We'd love to be your partner. We know that this is the right thing to do. Today, our system is backwards. We wait for a child to have a mental health crisis at 17 years old. It's too late. Or we wait for the child to penetrate the criminal justice system. That's too costly. It doesn't make sense. Let's get to these kids early, and the school center mental health model is a way of doing that.
Great. Well, let's take a pause, and I'm going to open it up for question and answer. We had a QR code, and Kelly, have we seen any questions come through
We
that?
do. How can we collaborate to address the challenge of lead positioning that impacts the mental and physical health of our kids? Oh, sorry, lead poisoning, sorry.
What's that?
How can we collaborate to address the challenge of lead poisoning that impacts the mental and physical health of our kids?
Lead poisoning. There are good efforts, specifically through the city of Milwaukee. So I'd say, contacting the city, the mayor, and individuals within his team. It's an important issue. It's been raised more. You're hearing more about it in the news. So I think now is the opportunity where people are becoming more aware. There's more movement towards improving our lateral systems, removing the lead. So I'd say the best way to get involved on that would be to contact the city and see what they're doing to address this issue.
The only thing I will add to that, because absolutely it's a systems level issue. I think a lot about philanthropy can do so much, and thank you to all of you who are giving to organizations that you're passionate about. Philanthropy can do so much, and then it can't do beyond, right? So Empowering Minds, we are funding this now because we want to show everybody what a powerful model this is. Philanthropy alone is not going to be able to scale this across the community. We have a lot of advocacy work to make sure we're opening up public lines of funding to make this a routine part of every school that any kid attends. Same thing on lead laterals, right? Like the problem isn't that nobody wants to fix this. The problem is the billions and billions and billions of dollars it's going to take to fix it, not only here, but across the country. So we're working on it. And kids shouldn't be drinking lead today. So one of the things United Way has been doing in the last few years, maybe 8 years at this point, is making sure MPS, childcare centers, nonprofit centers have water filter systems in their facilities. Anywhere a pregnant mom is, through the city, we've been partnering to get kits to these moms so that anybody who hasn't had yet the opportunity to have a lead lateral removed from their house is not forced to drink that water today.
One other thing I would say is that I would imagine, in hearing what you've had to say today, that by being embedded in schools, in the areas where the kids are, but also through this family model where you're looking at social determinants of health, you're doing home visits. LSS is working with elementary and middle schools, you're prioritizing high school, so it's really the life continuum of these children that hopefully, as we're in these areas, we're also able to send kids to get additional help and to help their family find these resources that exist. I think that's part of what you're both saying, that by leveraging the relationships and seeing kids where they are, we're also seeing that you might have a need here, or we might need to recommend that you see somebody else. And that's a strong web of support for kids in our community.
What are some direct things parents, aunts, uncles, family can say to start the mental health conversation, or if the conversation has begun to help?
Just yesterday, there was a panel at United Way on this. I'm looking at Lisa because I know she was there. And so I was listening to Linda Hall, who's the head of the Office of Children's Mental Health for the state of Wisconsin, and some other great experts. And they reminded us that one of the reasons we don't ask a question sometimes or say something we should say is because we're worried about saying the wrong thing or we don't know what to say. And it was such a good reminder that you can lead with that. You can say, I don't know what to say, but here's what I'm seeing. And I would love to hear from you what you're experiencing or what you want to share or what this feels like. So, child I love, I don't know I'm not quite sure what to say, but I've noticed lately when we're getting together, you're pretty disengaged. Like, it just doesn't seem like you're paying attention. It doesn't seem like you are having fun the way I remember you having fun doing this stuff. Like, I don't know if I'm right, but does it feel like that for you? Like, what's going on for you? And then stop talking for as long as it takes for that child to say something, right? Because that child does not have that script like ready, like, oh good, here's my opening, I'm gonna start talking. Like, the child's they don't know, they're figuring it out, they're grappling. And if you can sit there with loving compassion and patience for that child, I think the fear is they're next gonna say, here's this thing, what are you gonna do about it? And you're like, I don't know what I'm gonna do about it. What you can say is, I don't know exactly how to fix this, but I'm gonna figure it out with you. We're gonna work on this together. I'm gonna stay with you on this until we figure out what's something we can find that's gonna be helpful for you. Is there any ideas you already have? Is there anything you've already said, like, you think would be helpful to you? The answer might be yes. The kid would be like, I need this hour, I need this resource, I really wanna be able to go do this. Maybe, or not, like, we're gonna figure this out together, right? So just to be there with a child and know that you're paying attention, you care, and you're gonna be with them in what's next is so, so powerful.
Yeah, I would just add that don't go alone. Don't do it alone. Get help. Maybe there's a friend or someone within your family that might have some experience in this space. I know stigma is a big thing. It seems like after COVID, things have gotten a little bit better. People are more open to talking about their challenges. But stigma remains an issue. But so having those friends to talk with, but also your employer. There's lots of services through HR that can help provide additional resources so that you're not doing it alone and that you have help and assistance along that journey.
And I'll also say that I know we have partners across this area who are working on this. And one of the great things is that it captures children at different entry points. And I know that Children's of Wisconsin has also prioritized, one, screening kids, talking to them every year about, are you feeling hopeless? And also embedding behavioral specialists in clinics. We also work with kids, right, who they don't have a primary health person. So then it's educating teachers. But I love that idea of just open conversations and being present with the young people in your life and sharing your experiences and opening the door to allow them to talk about feelings and the fact that they don't have the script, right? I've got a script, but they don't. And so working with kids, being understanding of that. Kelly, any other questions for us?
Not unless there's any live questions.
Any live questions? Okay. Then seeing none, I would really like to thank you, Amy, for being present and being here and being our partner in this work. And just sharing so openly, and Héctor, your leadership of LSS, and really being the champion of school-centered mental health and working with these 11 schools and hopefully growing this program. And in fact, I would love to turn it over to you, Héctor, and just give us the opportunity to wrap up this discussion with our partners.
Thank you. Thank you so much, Mara, for leading us here today and for all your behind-the-scenes work. Kelly, thank you so much for the great work you've done and the great attendance we have here. Jose, thank you for your hospitality, your service on our board, your friendship and everything you have done for me personally and for LSS. The mayor, Amy, thank you for your friendship, for your wisdom, and for all that you shared here today. Some of the statistics we heard, again, are sobering. 1 in 6 children are facing a mental health issue, most of the times undiagnosed or unsupported. It's a big challenge. 40% feel sadness and hopelessness. These are sobering statistics. And there's programs like you heard today from United Way and from LSS that gives many of these kids hope. That gives many of these kids the chance to succeed in life. And it's our, I would say, our responsibility to try to do something about it, to make a difference in a small way. Maybe it is through a donation. Maybe it is supporting a family. Maybe it is giving one of these parents an opportunity, the training, so that they can have a good job that'll lead to financial viability within that household that will help them. So there's lots of ways that you can be a part of the conversation. But we thank you so much for being here today and being part of this conversation with us. We are so grateful to all of you. And remember, you are a partner. This is the partner circle. So if you need, if there's any challenges that you are facing with regards to anything we talked about today, know that LSS is here to support you and be on that journey along with you. Thank you.
Just wanted to one plug for our November Partner Circle event. So Tuesday, November 14th, we are holding our Partner Circle evening event. It is a wonderful opportunity to just come in and be in partnership with each other, share an evening of cocktails and heavy hors d'oeuvres. We're going to be honoring some of our local heroes. So Matt Burrow of Catalyst Construction is receiving our Civic Hero of the Year award. We're also going to be honoring the First Lady of Wisconsin and her work around advocating for the people in our state. And lastly, we're going to be honoring St. John's on the Lake and our partners there. So please come, enjoy time with us. This is always such a beneficial opportunity for us to network and to be in partnership and to think about the people in our community who need our support. Thank you.